Before we get started, I want to take just a few minutes and explain to you a little bit about peripheral neuropathy, some of the symptoms you may be experiencing, why you're experiencing those. I want to explain a little bit about nerve physiology, electrophysiology, how it functions, how they become damaged, and what your treatment options are. There's been great strides made in the last 10 to 15 years on therapies, and I'm going to show you some of the therapies we use in our program, why they work, and the results that we're getting. And then in just a few minutes I'll be in to talk with you personally, and we're going to discuss your condition, and I want to know how it's affecting your life, what your goals are, and then we're going to do some tests, very specific tests to determine the damage that's taking place and if you're somebody that I feel we can help and if we can help you reach your goals, okay? So when we talk about peripheral neuropathy, depending on where you look, there are hundreds, some sources say up to 200 causes of peripheral neuropathy. But if you boil all those down, there's three basic things that are taking place, three basic root causes that are damaging the nerves. And by far the most common is a circulation problem. Little tiny microcapillaries, the last part of the capillary or circulatory system that those red blood cells have to get through to supply nutrition and oxygen to the nerves, as those become damaged, the nerves are deprived of oxygen. That's called hypoxia. So when hypoxia sets in, the nerves begin to malfunction and ultimately they begin to die. And that's the most common cause of peripheral neuropathy. Now this is what happens with type 2 diabetes. And a lot of people think that type 2 diabetes and peripheral neuropathy are synonymous, and they're really not. It is the most common cause of peripheral neuropathy, but for every person with type 2 diabetes, there are 5 people with neuropathy that aren't diabetic. So there's a lot of other things that can be at play. So microcapillary damage or a circulation issue is the most common. And the second most common thing that we see is a chemical damage, chemical issues. So this is common with some pharmaceutical drugs that can cause damage. Chemotherapy is very common. We see a lot of patients with chemotherapy-induced peripheral neuropathy. And also liver damage or alcoholism, things like that. But it can be a buildup of chemical toxins that is causing damage to the nerves. That's one way it can happen. The second way that it can happen with chemical damage is the chemicals themselves can be interfering with the absorption of nutrients that the nerves need to function properly. So that also is very common. And then the last primary root cause is injury or trauma to the nerves. Now this could be surgical trauma and damage, or it could be spinal issues, things like spinal stenosis where the spinal canal is narrowing and causing pressure on the spinal cord or nerves, or it can also be disc bulges herniation, spinal degenerative disc disease, things like that. So those are by far the primary root causes of peripheral neuropathy. So if we look at somebody who has an infection or somebody who has damage or trauma, they all boil back down to these three basic things. And those are the three things in our program that we look to address simultaneously to get you the best results possible. Now, if you're like most people that come into our office, you have probably been told that there's nothing you can do for your peripheral neuropathy. And let's see if you can relate to this. Have you been told that you're just going to have to learn to live with it? I hear that one a lot. So I want to give you some hope today. That's not necessarily the case. In fact, the majority of patients that come into our office, we're able to help with our programs, because if you catch it before it's too late, in other words, if you catch it before it's reached the point of no return, then there's a lot that can be done to reduce your symptoms, to improve your quality of life, and to stop the progression of your neuropathy. So it's very important you understand that over 50% of people with peripheral neuropathy will slowly keep getting worse as the years go by. We don't know who those people are. We don't know who the lucky ones are going to be. See, the lucky ones are the ones who plateau and they stop. At some point they stop getting worse. But the unlucky ones, which is at least 50%, will continue to get worse and worse and worse. The late stages of peripheral neuropathy, I can tell you in 3 years of focusing on peripheral neuropathy, and we have seen, I don't even know how many patients in our office, but many, many patients suffering with peripheral neuropathy, all the way from early stage to very late end stage peripheral neuropathy. And I can tell you, as it gets worse and gets to the late stages, it is unbearable for many of them, and they're truly suffering. And if that's you, there is still hope. We have to determine if you've reached that point of no return, if you're at that threshold or not. And if you're not, then there's very good odds that we can improve your condition and help you. And I'm going to explain why here in the next few minutes. So with peripheral neuropathy, I think if you understand how your nerves work and how they become damaged, the treatment modalities that are available today will make a lot more sense to you. So what happens when people develop peripheral neuropathy? Most of the time it will start off as numbness, the vast majority of the time. It'll be numbness in one or more toes, then it'll spread to all the toes, then the bottom of the feet, and eventually the top of the feet. As it's spreading to the top of the feet, people usually start getting pins and needles or tingling, intense tingling. As it continues to spread up the legs, then about the time it's moving up the legs, oftentimes people will start to get a little numbness in the fingertips. And maybe that's you, maybe you have it in both the hands and feet, maybe it's just the feet. But as it progressively worsens, then in the later stages, as it's moving up the leg, is when people will start to get electrical shock pain, muscle cramps in the lower extremities, restless leg syndrome, circulatory swelling in the lower extremities, all kinds of symptoms. And I want to explain how your nerves work so that you'll understand why those symptoms happen. So if I take you back to high school biology, and you remember our nerve cells, how they work. So we have, on one end, we have what's called the dendrite. And this nerve tissue is very fine nerve tissue. It goes into all your skin and organs, body tissues. In fact, if you were to melt away everything except your nerve tissue, you would still almost be recognizable. It's that in depth. But these little nerve receptors, when they're stimulated, they will cause an electrical impulse. It's electricity. This electrical impulse will travel through your nerves to the cell body. So the cell body is like a little tiny miniature brain. It will interpret that signal and it'll pass it on down the other end of the nerve, which is called the axon. And you probably remember this term called synaptic junction. It's a fluid sac that connects one nerve to the next nerve. Now in the synaptic junction, it releases neurotransmitters, things like dopamine. There's several of them. But that neurotransmitter will stamp that nerve, and it's like a stamp, and it will tell the next nerve what to do, basically. And so then it'll go from the originating nerve to the next nerve, all the way up to the brain and back in a split second, which is fascinating. So when you step on a tack, it should feel like a tack, and you get an appropriate response. If we rub a feather or a piece of cotton across your foot, you should feel feather or cotton, right? Not a hot poker or an electrical shock or intense tingling. You should feel it. That's if everything's working properly. So what happens when the impulse goes through the cell all the way up to the brain, then the brain sends an impulse back. Now this is important for you to understand, because when the impulse is traveling back, it's traveling along the outside of the nerve, along the myelin. You've probably heard of that, the myelin sheath. It does a lot of things. One of the things it does is it insulates the nerve. It insulates like an insulation on a wire. But when the brain is sending that impulse back, it's a DC current. It's a different current. Now what that does is it resets the nerve so they can fire again. It also communicates with the neighboring cells and nerves to tell them what to do. And so it's very, very important that that's happening, that it's going on the way to the brain properly and on the way back properly. And so have you ever wondered, why do I feel numbness, but I feel pain also? If that's you, I'm going to explain why those symptoms happen. It's very important that you understand a couple things today. Number one thing that's very important to understand is that there's no such thing as a drug that will ever stop neuropathy from getting worse or improve your condition. Now the drug will mask the pain or the symptoms and may make you feel better, but it never does anything to actually improve it. And so with neuropathy, the standard medical model or treatment approach is to prescribe gabapentin. By far, most common thing that I see is people are put on 300 milligrams of gabapentin by their doctor, whether it's their neurologist or podiatrist or medical doctor. They put them on gabapentin first to start off, usually 300 milligrams up to 3 times a day. Now, for most people, that will work temporarily. They will actually feel better temporarily. But as time goes by, their nerves are still getting worse, and this is the dangerous part to that. They're actually continuing to get worse. And what eventually happens, they have to go back to their doctor, and they say, hey, doc, you know, my symptoms are getting worse again. The tingling is getting bad again. And the doctor will up their dose of gabapentin typically to 600 milligrams 3 times a day. And then the process will keep repeating until they get to a point where they cannot increase their medication anymore. They're on the maximum dose. And then oftentimes they'll add Cymbalta or another antidepressant, or they'll put you on Lyrica. And then eventually they'll go for the heavy-duty pain pills, which we all know you don't want to go that route. That's a dead-end street. So you have to understand, and we understand, while there is a time and an appropriate use of medications to help you feel better, it will never help you actually get better, and hopefully that makes sense. So our approach is to address these three primary root issues. Get oxygen to your nerves, get nutrients to your nerves, help the nerves start to function and heal. Just like a plant, you know, if you had a house plant that's dying, you would look at a couple things. You'd say, well, is it getting enough water? Is it getting too much water? Is it in the wrong soil? Does it need better nutrients? Is it getting too much sunlight or not enough sunlight? You would start to look at what the root issues are, and if you address those root issues, the plant will heal and recover, and normal health and function will be restored. But if you wait too long, it'll reach a point of no return, because once the plant is dead, there's nothing you can do to return it to health at that point. It's just dead. And the nerves are much the same